Students at the Canadian Academy of Osteopathy complete a minimum of 1,000 hours in supervised clinical practice and training. This is done over the program's 4 years of education in the clinical semester of each academic year. In years 1, 2, and 3, student clinical rotations are done in the under-year practice clinic. This is a practice clinical environment where students treat other students under professional supervision. But this experience is far more formal than working on tables in the classroom lab. Students in under-year clinic practice their patient history and intake skills, they practice catching red flags, and they work on their osteopathic assessment and treatment skills. The environment is professional and runs like clockwork, like a real professional setting. In year 4, student clinical rotations are done in the upper year public clinic. This is the CAO's free clinic that is open to the public that serves the local patient community. Upper year students treat the public and see real patient situations under professor supervision. In the practical semester of year 4, each student will see 100 public patients. This is imperative to develop proficiency before students graduate. In addition to working in the upper year clinic, upper year students have another important layer to their clinical training. They work as teaching assistants, or TAs, in the under year clinic in the classroom lab. Through this experience, while the TAs monitor under year students working at the treatment tables, they hone their own abilities to observe patients and lesioning patterns, and they hone the ability to evaluate each of the under year students' approaches and make the necessary corrections. This TA experience has incredible outcomes for the upper year students' own thinking process and treatment skills. We call this the CAO apprenticeship phase.